In this video, Vlad and I are going to be talking about injury classification.
Yes, Ian.
Why don't you tell us a little bit about what that means exactly, Vlad?
Well, as we all know, Ian, there are so many types of injuries that can occur among tennis athletes.
Sure.
And the way we approach it is we really classify these injuries into several different classifications. And the reason for that, because the classification will actually afford us how to direct treatment. Let's say, for example, if we have these injuries of, the different body types, the neck, the shoulders, the elbows, the wrists, injuries of the low back, the hips, the knees, and the ankles. All of these can really occur, and it's such a wide range of injuries and so much diagnosis that we have to look into.
Right.
That really the format of this interview will actually not afford us to discuss all of these. All right?
Yeah, it makes sense.
Am I right on that one?
There's a lot of different body parts, right?
That's right. That's right. Yeah. So, what I'm going to ask you, Ian, is I'm going to ask you really to pick a body part or several body parts, if you may, and then why don't we spin off from there?
Okay. So body parts that in my experience, tennis players typically have issues with?
That's right. That's
okay.
Right. Yeah.
Well, a couple that you picked before I think were good.
Okay.
Wrist is definitely common. Elbow is definitely common. And then from there, I would say shoulder, back, and probably knees and ankles.
And ankles. Okay. So let's pick elbow injuries at this point. So let's start from there. Now, one of the most common classification that we use for elbow injuries are actually, is it something traumatic in origin or non-traumatic in origin? And what we mean by that is this, Ian. If it's something traumatic in origin, is there an event in the athlete's, playing life that actually occurred that brought about the symptoms on the elbow?
Sure.
Things such as a fall. Okay, or things such as even out of the playing field, things that they bumped the elbow at home, or they were working and something dropped onto their elbow. If it's something of a traumatic in origin, the things that we really ask is it something that is affecting the bone at this point in time?
Okay.
There could be certain affectations, Ian, it could be some fracture in there, there could be some ligamental problems in there, or there could be some dorsal problems in there. Now, the flip side of it is the non-traumatic in origin. If it's non-traumatic, did the tennis athletes all of a sudden wake up one morning with excruciating pain in the elbow? Now he or she cannot recall any specific event that brought that about. If that is the case, one of the things that we look when we do history taking is there something that really changed in their playing time? In other words, were they off, for a certain amount of time, not playing tennis, then all of a sudden, just go back to tennis and play full blast? That could be a certain cause of that non-traumatic event. The other thing also is we look into is we ask them about the equipment that they use. Is this something that they just bought or pick up from the shelf, in a certain store, or is this something that their tennis pros actually recommended for them? The other thing also is that we look into is we ask them the questions: are they taking any tennis lessons, at this point, or they just pick up the game, somebody showed them the stroke, and they just kept going? Now, if all those factors are actually coming into play when we interview them, part of the treatment that we do, Ian, is actually we refer them to tennis professionals. Okay. And then we have them actually get evaluated for the proper equipment that they have. We have them also evaluated on the tennis stroke techniques that they have.
Yeah.
Okay. Would you agree with me that those are important things?
Yes, I would personally say more so the technique than the equipment. Okay. Having the wrong equipment can definitely lead, especially to tennis elbow type issues. But in my experience, I think poor technique even more so. I mean, just moving the body in a way it doesn't like, and then doing it over and over and over again, it absolutely can lead to problems.
That's why we actually, we partner in this in terms of treatment, because that actually is out of the scope of our practice. That's why we refer this people back to you. Sure. Okay.
So in terms of actual classification, you talked about traumatic versus non-traumatic. I'm assuming that trying to diagnose exactly what a non-traumatic injury, like the origin or how it occurred, Sounds like it's probably a lot tougher to do, isn't it?
That's right.
Traumatic,
that's
if something falls on your arm, all right, great, I know what happened, but untraumatic sounds a little bit more tricky from your perspective.
It is, but you know, as we move along in terms of the questioning, you know, we do during the initial evaluation, during the history taking, some of those questions actually pops in, or even sometimes the tennis athletes will volunteer them out in terms of like giving those information.
Sure.
So those are, if you look at treatment, we usually look at it as puzzles. So that's one big part of the puzzle, because yes, you know, we can treat these injured athletes, but if we don't approach that part of it, then they just keep re-injuring themselves. And I think we're doing a disservice to them if we do not do that.
Sure.
Okay.
And again, I can imagine that what we're talking about here, injury classification, is probably vital from your perspective, because we need to diagnose the right problem, right?
That's right.
Basically, what we're getting at here is, if you can't figure out exactly what the issue is, then finding the right treatment is going to be obviously tough, right? Or
that's
impossible.
absolutely right. That's what I'm actually leading into, Ian.
So you want people at home to make sure that they understand the different possibilities. And you mentioned briefly bone, ligaments, muscle.
That's going to be another...
all right, I'm getting ahead of myself.
Exactly, you are getting ahead of yourself.
All right, two more questions here that I wanted to ask you about that.
Actually, there's another, you know, if you don't mind, Ian, there's another classification that we commonly use.
Sure.
And the other classification that we commonly use is we often group the injuries into something of an acute in origin, subacute in origin, or chronic in origin. And what do we mean by that? You know, so acute injuries are actually injuries that happen within 72 hours. Subacute ones are the ones that happen within 72 hours to about 2 weeks, and chronic ones are the ones that happen 2 weeks onwards.
Okay.
The pain is persistent on those ones. Now, how do we approach treatment, you know, with this classification? Usually the acute type of injuries, if it happened within 72 hours, we follow the treatment we call, you know, the Rice principle. And I'm sure you're aware of that.
I've heard it. I can't remember the acronym though.
Yes, the acronym stands for actually REST for R. I is ice, and C is compression.
Okay.
See, you know this, and E is elevation.
All right.
Okay. So usually within those 72 hours, these are actually good, but after 72 hours, during the subacute and the chronic phase of treatment of the injury, then basically what happens is we use different types of treatment. We actually will have to, from ice we graduate into heating modalities. We actually use electrical modalities. We use different exercise techniques such as stretching and strengthening. We use actually mobilization techniques. We used soft tissue mobilization. So those are but a small part of the things that we do in terms of treating this type of injuries within those subacute and chronic stage.
Okay. Anything else you want to talk about as it relates to classification of injuries?
Now, there's actually one more classification that we used, and we find this most useful with physical therapists in the clinic. And then this is the one that you're actually alluding to in terms of, you know, the injuries. When we see athletes, we often ask what structures are involved. You know, is it something that has to do with the bone? Is this something that has to do with the joint? Is it something that has to do with the ligament? Is this something that has to do with the muscle or the tendon? Or is it something that has to do with the nerve? Now, you might ask, you know, again, what is the importance of this classification? Let's pick a nerve injury in the elbow, and usually it occurs around the areas of Roche. If that nerve injury is improperly diagnosed and you start giving them exercises involving exercise that is good for muscle or a tendon, you might actually make them worse.
Sure.
Okay?
Right.
So, and on the flip side of it also, if you actually have nerve exercises that you do for a muscle or a tendon problem, then it will not actually benefit from that, because the repetitions of nerve exercises are not enough to actually make changes on certain muscle and tendon conditions. Now, if it's a joint problem, it actually warrants us to actually look deeper into what we call a joint play of the elbow itself. And what we mean by that, by joint play, is actually there are certain rolling and gliding motion that occurs in every joint of the body. And those gliding and rolling motions, all of them have to be present, you know, to have a good motion to the elbow itself. If you don't have those motions, Ian, then it will be impossible to really create a good motion, and that can actually translate to symptoms onto the elbow.
Gotcha.
Now, how do I educate patients in the clinic about joint play? And one of the most important thing, or the easiest thing that I usually do is, if you look at my hand, if I actually move it back and forth this way, the outer part of my hand, I can do that. I cannot actually do that by contracting my muscle alone. Now, that's what we call joint play. Every part of the body has to actually have that. Now, without that joint play of my hand, I will not be able to make a fist. Without proper joint play on each part of the body, then it's impossible to do proper motions.
And again, you know, coming back to, I guess the point is figuring out where the injury resides exactly is going to determine what type of treatment.
That is absolutely right. Yep.
And I can assume, I'm sure correctly, that obviously the best thing to do for viewers at home, if they're not sure what the classification of injury is, would be to go see a professional, correct?
That's absolutely right.
All
That's absolutely right.
So, I mean, we're going to talk about things in the future videos about how to hopefully pick out what the problem is, but people really need to go see a qualified medical professional, don't they?
I would more than you know, say that that's really the best thing to do at this point in time.
Okay. Anything else, Vlad?
There's actually a last one that we want to talk, Ian, about, you know, certain areas of the body that is really outside of the elbow that can actually refer to, you know, pain onto the elbow. And, you know, one thing also that we look into, you know, when we look at injuries is really to look into the wrist area. You know, if there's a malalignment of the wrist bones and the wrist bones are not properly moving, it actually creates a tremendous amount of force that actually will create an overuse syndrome, you know, for the forearm muscles. Now, again, that translates into pain onto the elbow later on.
Okay.
If the shoulders, actually, some of the muscles are not strong enough to create a good movement for the shoulder, that again translates to abnormal forces onto the elbows. Certain neck alignments and upper back spinal segment alignments, if they're not moving properly, can create irritation on the nerve that again can refer pain down onto the elbow. Certain neck muscles, which can be tight, can actually elevate the first rib, and again that could actually refer pain down onto the inner aspect of the elbow, Ian. So I'm sure, let me ask you this question. In your blog, have you had certain athletes, you know, email you stating that they have elbow problems, they've been doing stretching and strengthening exercises, but to no avail, they're not improving?
I don't think on the website specifically, but when I was teaching full time, that's something I definitely saw repeatedly, where there was usually like an overuse or usually poor technique and then repetitive use type injury with the elbow, and they would try to treat it through various methods. And yeah, I definitely saw several players where it just, they couldn't figure out how to make it better.
So you know, that's what I'm alluding to actually, Ian, that might be actually, they might be exercising the wrong body part because the problem might be arising actually from the neck.
From a different part than what they're trying to exercise.
Right. So I think, you know, where I'm leading with this, Ian, in terms of you know, really looking to have a consultation with the medical professional. I guess, you know, the bottom line is if the injury has been persistent for more than 2 weeks, and if they're accompanied by swelling, if they're accompanied by numbness and tingling, if there's loss of motions and weakness, then I think the proper way to do is to really seek a medical professional for that, because with proper classification of those injuries comes proper treatment, and with proper treatment comes healing.
Sounds pretty important.
Okay.
So the bottom line is it's complicated. You want to make sure you target the right area.
Yes.
So that people get better as quickly as possible.
Okay. Yep. That's exactly what the message that we want to partake to your viewing audience.
All right. Well, great stuff. Thanks a lot for the information.
You're more than welcome.